So today I just wanted to talk about something that we are so passionate about here at our office, and it's the connection between overall health and oral health. And specifically today, I just want to go over some of the ways that our sleep can affect our mouth and the rest of the body as well. So how can sleeping affect the mouth? There's actually a couple different ways. And one of the things that we're always cognizant of and screening for, we keep an eye out for things like sleep apnea or sleep breathing disorders. These are conditions where at night you are essentially suffocating multiple times during your sleep, and your body has these micro awakenings where you're not getting enough oxygen to the brain, and you're releasing all this cortisol, this stress hormone, to wake yourself up so that you can breathe and get oxygen. This has huge implications to overall health. It can increase your risk of heart disease, cancer, any type of inflammatory process can be exacerbated by sleep apnea. So keeping an eye out for that is super important. Some of the signs, regular snoring at night, making sounds of choking at night, feeling really tired even if you get a good amount of sleep, etc. And if you do suspect it, see your family doctor, see your dentist. We can chat a bit more about it and talk about it. The treatments for sleep apnea, there's the CPAP machine, which is a device that you wear that helps just give you airway flow. And then there's something called an oral sleep appliance, where you sleep with it at night. It's something that goes into your mouth that your dentist can make, we can make for you. And you wear it, and it helps reposition the jaw so that you're able to keep your airway open while you're sleeping. So that's sleep apnea. What's another thing that's really important to keep an eye out for with sleep? Mouth breathing. Our mouth is for talking and eating. Our nose is primarily for breathing. It's a lot healthier for overall health and oral health to breathe through your nose at night. Now, with mouth breathing at night, some of the things that can happen. In terms of oral health, your mouth is more dry when the mouth is open, and that increases your chance of having gum inflammation and also having cavities. When you have a moist mouth, when you have saliva, saliva serves the purpose of keeping the mouth cleaner. So it definitely can affect your oral health. And then the other thing with mouth breathing, oftentimes people don't get as restful of a sleep with mouth breathing. They're more prone to things like allergies, sinus problems, etc. So if you're noticing mouth breathing, it's not a bad idea to get your airway checked. See if there's a blockage in your nasal passage, if you've got problems with your sinuses, if it's something structural that can be dealt with. It's not a bad idea. Could be something that's a habit, in which case you could use something like mouth tape. It's a tape that you put over your mouth that just keeps your lips closed at night. But always check with a professional first, just to be safe. Treating mouth breathing, especially in children, can have huge implications in long-term health. When kids, especially, are breathing through their mouth at night, air gets filtered by the nose. So it cleans out bacteria, toxins, etc. Because we have these little cilia in the nose, there's immune cells in the nose, and it filters the air. It also humidifies the air. So when the air goes to the lungs, there's better oxygen exchange. So our mouth is less efficient to get oxygen, doesn't clean the air as well. So it's like we're doing a job less efficiently long term. And for kids especially, mouth breathing can also lead to different types of facial development. Why is that? When the mouth is open, the tongue usually will sit on the floor of the mouth. Usually during normal development, the mouth is closed and the tongue rests on the roof of the mouth. The pressure of the muscle, so the tongue is one of the strongest muscles, and the pressure of the tongue on the roof of the mouth helps guide the growth and development of the upper jaw, which is called the maxilla. It helps give you this nice broad arch, creates lots of space for the teeth. It helps actually the nasal passage grow nice and wide as well, because the roof of the mouth is also the floor of the nose. They kind of grow together. And so the wider that is, the better your ability to breathe long term. And so this can kind of be your cycle in a way. So if you're noticing your child breathing through their mouth at night, especially if there's some kind of snoring, if there's some kind of blockage, definitely see the dentist, see your family doctor, get that treated right away. So this is how sleep can affect oral health for sure. And the ways that sleep has a huge impact on general health. Getting a good quality of sleep is essential for immune function. It's essential for cognition, for remembering things. It's essential for pretty much every single bodily process. While we're sleeping, your brain does what's called, it cleans out toxins while you sleep via what's called the glymphatic system. So you're sleeping, and it's only during deep sleep that this happens. So if we're cutting back on our sleep, there's higher risks of Alzheimer's, higher risks of cancer, higher risks of heart disease, you name it. So that's why sleep is so important. It's so important to prioritize. Try to get 7 to 8 hours per night. Everybody is a little bit different, but aiming for that, if you're an adult, is a good idea. Some things that have helped me a lot. I didn't used to sleep very well. I used to have trouble. I wouldn't track my sleep. I was drinking a lot of caffeine. So I read this book called Why We Sleep by Dr. Matt Walker, and it's probably the book that's had the most impact on my life. From that book, I took away a lot of really practical tips that can help improve your sleep, and it helped me immensely. I started to make sure that my room was completely dark at night, avoiding any ambient lighting. I actually sleep with an eye mask, so there's no light getting in. You try to eliminate noises as well, as much as you can. Try to sleep in a silent room. I do that with earplugs. The other thing that's really important, trying to go to bed and wake up at the same time every day as much as you can. It helps your body get into that circadian rhythm. The other things that I've started doing, I don't drink caffeine other than early in the morning, because for me it does really affect my sleep. I avoid drinking things like alcohol before bed. I try not to eat too close to my bedtime as well, to give your body time to digest. All these little things, even sleeping with the room at a slightly lower temperature is better to have better quality sleep. Weighted blankets have helped, etc., etc. There's tons of tips that I can go on, and some of the other things too, actually, that I'll quickly touch on. Trying to make sure you're in the right headspace before you go to sleep, because a common thing that I hear from patients, that the reason they can't sleep is they lie in bed and their mind is just racing, and they're going over their day, they're repeating what's happened, they're in this cycle, and it's hard to get out of. What I found helps with that is doing things like guided breath work or meditation exercises. You can download apps, free apps on your phone. There's free ones on YouTube, just to help get your focus out of your head and more into your body and into your breathing. So any of these little tips hopefully can help. And what this is about, it's not about trying to change your life completely and doing all that. You can try, it's hard, but you could. But making 1% changes here and there. The short term, you won't notice any difference. But these little changes for your health, long term, you'll end up in such a far better place. So it's little investments that you can make in your overall health, oral health, etc., that will make a big difference long term.